Okay, good afternoon or good morning, class. So in this video lecture, we will be talking about posology and dosage calculations. So this will be part of your finals grading period and will be purely taught online. Okay, so to start, what is posology? Posology is a branch of medical science which deals with the dosing of a drug to a patient. So a part of posology is the computation of how much should the patient receive. So or how much the drug a patient should receive. Another branch of posology in medical sciences is calculating what is the average dosing for a patient. You will learn this more on your biopharmaceutics and pharmacokinetics, but for now, we're going to design a dosing or we're going to decide on how much drug a patient will receive based on certain parameters. Okay, so why do we need to compute for dosages? There are some drugs that have a fixed dose for adults and children. However, there are some drugs still based on the age or weight of the patient. So why is this? Because it is related to potency. We have some drugs that are safe to give in large doses, while we also have some drugs that are more potent, meaning a small amount could be toxic to a patient. So we need to adjust the dose because of the potency of our drugs. Some of our drugs also adjust their dose accordingly if the renal capacity of the patient is deteriorating. So drugs like your aminoglycosides or any nephrotoxic drugs need to be adjusted accordingly depending on the kidney function of your patient. You will learn this more on your hospital pharmacy and your clinical pharmacy. Okay, so let us differentiate what is dose from dosage. So a dose is the amount of drug to be taken at one time. So an example is 300 milligrams. While dosage is the pattern of the taking of the drugs. So most of the time in the prescription, only the dosage is written. So this is the pattern of how to take the drug. So example is 300 milligrams every 4 hours. So it includes the dose together with its frequency. So to start, what are the sample computations by body weight? So when adjusting the dose, the simplest form of adjusting the dose is by body weight. So this is the simplest computation. We just multiply the dosage by the patient's weight in kilograms. The drug dose is shown as milligram per kilogram. So even if the patient is pediatric or adult, it is suited to the patient because the dosing is on a per weight basis. So in this case, the patient's dose is patient's weight in kilograms over drug dose. So the patient dose is patient's weight in kilogram times the drug dose in milligram per kilogram. So these two will cancel each other out and you will have milligrams only. Next we have Clark's rule. Clark's rule also based on weight and it is suited for our pediatric patients. So Clark's rule is the patient's weight in pounds over 150 pounds times adult dose. So 150 pounds is the average weight of a person. So Clark's rule is the patient's weight in pounds over 150 pounds times the adult dose. For some reason, nagdidikit-dikit yung aking sulat. Okay? Next, we have calculations based on age. Most of the time, calculations based on age is purely for pediatric patients. Okay? So, first we have our Young's rule. Young's rule depends on the age of the patient in years. Okay, so this is the age of the patient in years. It is age, patient's age, over patient's age in years plus 12. Then multiplied by the adult dose. Next, we have Freud's rule for infants. So this takes into consideration the age in months. So the formula is age in months over 150 months times their adult dose. This is in milligrams. Okay, so months will cancel each other out and you will have milligrams. Next type of computation is based on body surface area. So what is body surface area? Body surface area is a unit of volume denoting the total space that a drug can possibly occupy. So this is in meter squared. So this is a term of volume. It is in meter squared. Okay, and the formula for body surface area is height in centimeters times weight in kilograms over 3,600. Okay, class, please take note of the unit. It is centimeters and it is in kilograms. Do not forget. So most of the time you will be given problems like the patient's height is in inches or feet, while the patient's weight is in pounds. You have to convert it first to kilograms and to centimeters before you start your computations. Okay, for computation of body surface area, we have two types. Okay, so the average body surface area of a person is 1.73 meters squared. So to get the adult dose, you simply need to multiply the you need to multiply the adult dose multiplied by the patient's BSA over 1.73 meters square. So patient dose equals patient's BSA over 1.73 times the adult dose. Some drugs dosing is already based on the BSA. So we have drugs that are already in milligram per BSA like this one. You simply need to multiply it by the patient's BSA. So patient's dose is drug dose in milligram per meter square multiplied by the patient's BSA in meter square. So these two will cancel out and you will end up with milligrams. So some considerations and problem solving. Some other considerations are the frequency in dosing. Sometimes you will be asked about how many total drugs is given to a patient in consideration of the total duration of therapy. Some problems also give the amount of drug per dosage form. Example, an 80 milligram aspirin tablet. A patient is required 240 milligrams per dosing. How many tablets are needed? Also, please take note if the computed total amount is not conforming to whole dosage forms, you are supposed to use one more dosage form to ensure that the required amount is given. Basically, you need to round up to the nearest whole number. Okay, so this is the summary of our different formulas. So effectively, you have 6 formulas you can choose. Okay, please take note for pediatric patients. It is always indicated what rule you are supposed to be using. Okay, if there is no rule given, you are supposed to use this one, the weight, the based in weight one. Okay, now to choose between the two types of BSA, you need to check the dosing. Okay, so the adult dose is usually in milligram per meter square. Okay, if this is absent, meaning if this is missing, you're going to use this one. So you need to divide the patient's BSA over 1.73. Okay, so before we move on to the sample problems, I want you to solve on your own. Then I will solve the problems in this video. Okay, so first one, a patient with a body weight of 62 kilograms was given to a patient with a body weight of 62 kilograms was given a drug to be given with a dose of 25 milligram per kilograms. How much do you need to give? How much of the drug do you need to give the patient? You simply need to multiply the weight by the dosing. Okay, so 62 times 25. That is 1,550 milligrams. Okay. Next one. A patient was prescribed 2 tablets of Metrol, 4 milligrams every 12 hours for 5 days. How many tablets does he need? Okay. So the dosing is 2 tabs per day. 2 tabs every 12 hours for 5 days. Okay, so 2 tabs, 12 hours. 5 days has how many hours? 5 times 24, 120 days. Okay, so I mean 120 hours. Okay, so 2 divided by 12 times 120. He needs 20 tabs. Okay, please take note, class, that this question is not asking for the amount of drug in milligrams. It is asking for tablets. Next, a child was admitted into the ward and was immediately prescribed an antibiotic with an adult dose of 10 milligrams per kilogram body weight. If the patient weight is 12 pounds, how much of the drug is needed? So the patient's weight is 12 pounds. However, the dosing is in milligram per kilogram. We need to convert it first to kilogram. Okay, so 2.2 pounds is 1 kilogram times the dosing is 10 milligram per kilogram. Pounds, kilogram. You will have 12 divided by 2.2 times 10. The patient needs 54.54 milligrams. Okay. Alright, so I cannot seem to find a quick solution for the ink automatically connecting to each other. Okay, so let's continue. So a 6-year-old pediatric patient was prescribed a corticosteroid for treatment of asthma with an adult dose of 350 milligrams. Use Young's rule in computing for the dose of the child. So what is Young's rule? Young's rule is based on the patient's age. It's based on the patient's age. Okay, age over age plus 12. Okay, so a 6-year-old was prescribed a corticosteroid for treatment of asthma with an adult dose of 350 milligrams. Okay, so that's the patient is 6 years old. 6 plus 12, you will have 6 over 18 times the adult dose, which is 350 milligrams. 6 divided by 18 times 350, you have 116.67. Next, an infant with acute edema was prescribed a dose of hydrochlorothiazide with an adult dose of 125 milligrams. How much will you give to the patient if the patient weighs 32 pounds? Use Clark's rule. So Clark's rule is based on the patient's weight in pounds. So Clark's rule, so 32 pounds over 150 pounds times the adult dose is 125 milligrams. The dosing is 33.33 milligrams. Okay, let's wait for a little bit. Anyway, okay. Okay, so next, the dose of gentamicin for patients with impaired renal function is adjusted to ensure therapeutically optimal dosage. If the normal daily dose of a drug for adults is 3 milligrams per kilograms per day, administered into 3 divided doses, what would be the single dose for a patient's weight, which is 165 pounds and scheduled to receive only 40% of the usual dose based on renal impairment? Okay, so first let us compute for the patient's dosing. So the normal daily dose is 3 milligrams per kilograms per day. So the patient's weight is 165 pounds times 2.2 pounds is 1 kilogram, and the dosing is per kilogram you have 3 milligrams, and this is per day. Okay, pounds, kilograms, will end up with milligram per day. So 165 divided by 2.2 times 3. So the total is 225 milligram per day. Okay, it is divided into 3 doses. So each dose is 75 milligrams. However, the patient is only to receive 40% of the usual dose. So 75 milligrams is the usual dose and she needs to only receive 40% times 0.40. That is 30 milligrams. This patient is set to receive only 30 milligrams of the drug. The patient weighing 120 pounds was administered 2.1 grams of a drug supposed to be dosed at 30 milligrams per kilograms. Was the dose administered correct, or was it overdose or underdose? So in this case, the patient was already dosed. You need to check if it was the correct dose or not. Okay, to check, you simply need to compare it with the computed dosing. So 120 pounds, and it should be dosed at 30 milligrams per kilograms. Let us convert this first into kilogram. So since this will end up in kilogram, 30 milligram per kilogram. Kilogram. So 120 divided by 2.2. Times 30 is 1,636.36 milligrams. This is 1.63 grams. So the drug was 2.1. 2.1 is bigger than 1.63. The patient is overdosed. Okay, so please compute for the next please compute for the following questions instead. I will be posting another video with the answers for the next questions.